Hi, I'm Dr. Janet Alott. I'm a registered nutritionist with a special interest in food, and I'm here today to talk to you about gluten and the effect that it has on people with celiac disease. So if you think that celiac disease might be a problem and you think that the symptoms you're experiencing could be linked to celiac disease, the most important thing you should do is go straight to your GP to discuss the problems. Your GP will take a very detailed history of the symptoms that you've been having, and they may ask you to complete a food diary linked to the symptoms to find out exactly when these problems are happening. If the GP suspects that you might have celiac disease, the first thing they'll do is send you for a blood test. The blood test is something very simple that the GP can actually do in the surgery, or they'll send you to the local hospital. The blood test will show if you have antibodies to gluten within your bloodstream, so it will show if you're having an immune reaction to gluten. That's the first stage. If your blood test comes back positive, they will then refer you on to see a consultant gastroenterologist, probably at your local hospital. The gastroenterologist will then ask you even more detailed questions, but they will also ask probably for you to have a biopsy. And a biopsy is when a tiny piece of your intestines is removed through an endoscope, which is a small tube running down into your stomach and through into your small intestine. A tiny little piece of your small intestine is removed, taken away for analysis, and the consultant gastroenterologist will be able to tell whether your small intestine has been damaged by gluten, and if that's the case, they'll be able to give you a diagnosis of celiac disease.